An often incidental finding on a blood smear is intracellular organisms. And I'd like to just highlight the fact that these are things that you often won't see unless you're looking for them. And so as we go out to the feathered edge, we'll find our zone of morphology. So here's our zone of holes and our zone of morphology. And at higher power, we see, luckily, this case has numerous red cell inclusions. I would say a good 20 to 30% of the cells have intracellular inclusions. And so as we zoom around, you can see that these red cell inclusions look very different than a simple platelet overlying the red cell, which can sometimes be confused for an intracellular organism. If the clinician is suspicious for a parasitic infection like this, often those smears will go straight to microbiology and bypass heme. And so that's why I say that these intracellular organisms are often seen incidentally in the hematopathology division. The sheer number of intracellular organisms suggests to us that this is likely representative of Plasmodium falciparum. Here we see a cell with multiple organisms within the same red cell. That's also indicative of a Plasmodium falciparum infection. This is a chance to identify how small these organisms are and how readily apparent they are in some cases. Not all cases will have as blatant of an infection as this, and you may only see one or two intracellular inclusions while scanning throughout the smear. And so it would be a good idea to try and circle the areas where you feel that you're seeing intracellular organisms, especially if they're sparse, so that you can not only show your attending, but also get a curbside consult from microbiology. The other intracellular organism seen in red cells, in contrast to malaria, is this entity. And you may be thinking that these intracellular organisms look eerily similar to the malaria parasites. One thing to note is that there are both intracellular organisms and extracellular organisms, as seen here. Both malaria and this entity both show these ringed forms. This is an example of babesia, and only ring forms are seen in the blood, whereas malaria may show gametocytes and schizonts. Another thing to note is the size of these intracellular organisms. It will be difficult to identify the different sizes unless you have lots of practice. So as we move around, I want you to get a sense that these organisms are slightly smaller than the malaria organisms that we were seeing. In an ideal world, you'll be able to find these characteristic structures called Maltese cross formations, which is formed by a tetrad of four intracellular organisms that form this X shape or cross shape. However, these can be very sparse, and you may not even find one through scanning. But if you do, be sure to mark it, as this is a convincing structure for the organism Babesia in differentiating it from malaria. We heavily rely on our microbiology colleagues to help us in making these diagnoses. Sometimes all we can indicate is that we see intracytoplasmic red cell inclusions resembling parasites. And we may follow this up by saying that the physician should order a thick and thin smear to evaluate definitively for parasites with proper identification by the microbiology department.